Partial versus total colectomy. What's best for diverticulitis? When considering treatment options for diverticulitis, many patients wonder about the differences between partial and total colectomy. Let's explore these surgical options and how they relate to managing flare-ups and overall treatment. Partial colectomy is generally seen as the preferred surgical option for diverticulitis, especially in elective situations. This procedure involves removing only the diseased segment of the colon, which is usually the sigmoid colon. It is typically performed after recurrent or complicated episodes of diverticulitis that significantly affect a person's quality of life. One of the benefits of partial colectomy is that it can often be done laparoscopically. This minimally invasive approach leads to fewer complications, quicker recovery times, and shorter hospital stays. After a partial colectomy, the healthy ends of the colon are connected, a process known as primary anastomosis. In some cases, a temporary protective stoma may be created. Current guidelines and clinical trials support partial colectomy as the standard surgical treatment for diverticulitis. Evidence suggests that while this procedure may improve patient-reported quality of life, it does not necessarily reduce the risk of future surgeries or recurrence of diverticulitis at the population level. On the other hand, total colectomy involves removing the entire colon and is a much more extensive surgery. This option is generally reserved for rare and severe cases, such as widespread colonic disease or chronic inflammation. It may also be considered when there are complicating factors like severe motility disorders or cancer risk. Total colectomy carries higher risks of complications and can significantly impact bowel function and lifestyle. Because of these factors, it is not commonly recommended as the first-line surgical treatment for diverticulitis. In emergency situations, such as when there is perforation or peritonitis, a partial colectomy may be performed, sometimes with a colostomy, depending on the patient's clinical stability and the surgeon's expertise. Ultimately, partial colectomy is considered the best surgical option for most patients with diverticulitis requiring surgery. It balances effective disease control with the preservation of bowel function and quality of life. Total colectomy is reserved for select, severe cases. Decisions about surgery should be personalized, taking into account individual symptoms, risks, and preferences. It is essential to have thorough discussions with healthcare professionals about the risks, benefits, and alternatives, including medical management options. This patient-centered approach aligns with current surgical guidelines and ongoing clinical trials, emphasizing the importance of quality of life outcomes for those living with diverticulitis.